Hi, and welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs coloring book by myself to help med, nursing, pharmacy students, and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. If you'd like to color along with me, this book is available on Amazon and TikTok Shop now. Just search Top 200 Drugs Simplified. And with that, let's begin. Alright, today we're talking about Olanzapine or Zyprexa, a commonly used atypical antipsychotic that plays a role in treating schizophrenia as well as bipolar disorder. And to remember our brand and generic, we'll start with our PharmaLink phrase, which is just a quick memory hook that your brain can latch onto to help better remember the pair. An interesting fact about Zyprexa is that cigarette smoking can actually lower levels of the drug because compounds in tobacco smoke induce the liver enzymes that metabolize it, meaning that smokers often require higher doses than non-smokers to achieve the same effect. Clinically, olanzapine is used to manage acute agitation, treat schizophrenia, and stabilize mood in bipolar disorder. It may also be used for last-line therapy and treatment-resistant depression. To summarize our mechanism, we'll flip back to the high-yield review at the start of this chapter, comparing attributes from typical and atypical antipsychotics. Positive symptoms of schizophrenia, like hallucinations and delusions, are often driven by excess dopamine. Negative symptoms, like flat affect, social withdrawal, and lack of motivation, are often linked to low dopamine. Typical antipsychotics only block dopamine. An atypical antipsychotic like Zyprexa blocks both dopamine as well as serotonin to help better balance dopamine activity across the brain pathways, helping to reduce both positive and negative symptoms. Olanzapine is available orally as well as in a long-acting injectable. This can be helpful for patients to improve adherence and provide steady medication levels over weeks. However, it does need to be administered in a healthcare facility due to the risk of post-injection sedation and monitoring requirements. Moving to side effects, olanzapine also blocks alpha-1 adrenergic receptors, which may lead to vasodilation and drops in blood pressure, especially when standing. Olanzapine also possesses some anticholinergic effects. By blocking muscarinic receptors, it reduces saliva production and may cause dry mouth. Drowsiness is also common because olanzapine strongly blocks histamine H1 receptors, which play a major role in wakefulness and alertness. Weight gain is a common side effect of olanzapine because it blocks receptors that normally regulate appetite and satiety. It also increases insulin resistance, which together can drive hunger, reduced energy expenditure, and gradual weight gain over time. Olanzapine carries a black box warning for increased mortality in elderly patients. It may increase the risk of dementia-related psychosis because its sedating, anticholinergic, and cardiovascular effects can overwhelm an already fragile system. In older adults, these effects can increase the risk of falls, aspiration pneumonia, stroke, and other cardiac events. When combining underlying dementia with other medical comorbidities, even modest changes can sometimes cause fatal complications. And that completes our review. See you next time.